Hello everyone, and welcome to another special webinar put on by Fullscript. The topic today is functional medicine of the future, high volume outpatient care in an era of pandemics. I'm super excited to have my friend here, Dr. Cheng Ruan. He is a physician out of Houston, Texas. He is also on the Fullscript Medical Advisory Board, and he and I have been in really close touch over this whole pandemic because I think he is doing some of the most innovative stuff on the front lines of healthcare and making functional medicine and the functional medicine operating system something that could take this medicine from something that's happening sort of at a small level in private clinics to really a new way of thinking through the future of care in pandemics or otherwise. Now, we will have questions this afternoon, so you can ask questions wherever you are. If you use the question tab on GoToWebinar, we will have questions at the end, and we really look forward to seeing what you think about what Dr. Ruan is sharing and how you think you could implement some of that into your practice. You know, I'm here, and I guess I just wanted to start by saying that, you know, throughout the time at the evolution of medicine, you know, we realized that we needed a different operating system for the delivery of care. And it's clear to me, and it's probably clear to you if you're watching this, that functional medicine is an operating system of care that is better aligned, not just for lifestyle-driven chronic disease, but actually, you know, for pandemics. And we're going to be getting into that, and we're going to be talking about resilience. We're going to be talking about health creation along the way. But I'm fully committed to making this transfer from functional medicine being something that's for chronically ill people to functional medicine becoming an operating system for all of medicine. And in order to do that, we really need to think differently about how it's executed and how it's delivered. And so I'm really, really thankful that there are doctors like Dr. Ruan who are doing things on the front line. And so let's just jump into it. So Doc, thanks so much for being available today. Really excited to have you share some of what you've learned from for the audience here today.
Yeah, James, I want to thank you because this is really the first time since March that I've broken my silence since COVID-19 hit on digital media and social media. And so I'm really looking forward to share some of the stuff we're going to talk about today. So thank you.
So I guess, you know, one of the things that I learned about you, and I actually put in my book, The Community Cure, about your practice, is that you had sort of like, if we're all, many of us in functional medicine dealing with an atypical situation or sort of a crisis, you know, that can force a lot of us to have to practice and think about things in a different way. And I think one of the reasons why maybe you had a sort of a running start on this is that this isn't the first big issue that you faced in your practice. So why don't we just start a little bit about sharing sort of the first big stressor that you had to your practice, what you learned from it, and how that set you up for COVID.
Sure, and I'm a conventionally trained MD with an integrative mindset. You know, my mom does Chinese medicine. She's a Chinese medicine doctor. On my father's side, I'm the sixth generation of doctors who do integrative health. And so I've always kind of had that mindset going in. And then, you know, finishing medical school, finishing residency, doing my chief residency, you know, there's a lot of disruptions between what I thought medicine was going to be and what it actually was. So there were some pain points going through that. And so in 2017, after I've been in private practice for a few years, decided to start the Texas Center for Lifestyle Medicine. And the premise of it was just having more meaningful conversations with people and treating medicine more like us being coaches, more than just someone with prescriptive authority, right? And so it's funny because 2017 is also the first time I even heard of functional medicine from a friend of mine who got into it in Austin. And so kind of started that exploration route and ended up with where we are today. But the first pain point is that 6 weeks after, you know, I started the practice, and by the way, I started with 7 practitioners, so we went big. 6 weeks after that, we're in Houston and Hurricane Harvey hit. It didn't flood the practice, but it flooded my home. It flooded most of the homes of our patients that are around the practice. So we took a massive hit, decreasing volume there. just 6 weeks into practice and having a lot of cash flow issues on the business side. We had the pain point of not having all our insurance contracts finalized. And so insurance were asking us if they can delay us payment to 45 to 90 days just so they can keep up with the staffing for Hurricane Harvey at the time. And we're like, oh, wow, that's probably not going to happen. And developed a lot of processes and procedures to go through that, which thankfully really prepared me for when COVID hit. And we had some big changes due to the quarantine and stuff like that. And so I think I'm really thankful for all the hardships that I've seen in the past and continue to learn from the mistakes.
Beautiful. Yeah, no, I know that was a big deal. So let's go right back to the beginning of the pandemic and tell us a little bit about the model that you were running sort of in the weeks before, like where your model had got to before the pandemic hit.
Yes. So, I think that over the last 3 years, because our practice is only 3 years old, actually 3 years and 1 month old. Over the last 2 years, there's been a lot of permutations of the practice. We take insurances, we take government insurance, Medicare, TRICARE, military insurance, and going through that process and doing functional medicine is, everyone knows it's not easy. There's a lot of fights with insurance companies, reimbursements on the back end that took a lot of work. And there's also a lot of proving like what we do actually works. So getting clinical data. So there's the business side of things, insurance, there's the academia side of getting that data and showing to the insurance companies before they deny us for X, Y, and Z, hey, we're helping your patient, saving you X amount of dollars, and getting that advanced analytics going. And so that was what we were doing in functional medicine. We're seeing a lot of very typical functional medicine patients with a lot of different complex disease states. At one point, we had 17% of our population was from out of state. And we were having a very interesting population. A lot of times it's the people who've been seeking functional medicine for a very long period of time. And we were kind of getting that pot of people who have been on their health journey and been seeking us out and being in need of functional medicine. It was pretty intimidating at the time. So we developed very specific processing and procedures to allow that to happen in the insurance market. And we were doing well until COVID hit, right? And then COVID, what happened is that people's attentions went away from preventive medicine, health and wellness, and went into fear. And what happens is that we are now challenged with uncertainty. And I believe that the true core value of functional medicine is so that we can help people develop a level of certainty, right, with their health, mindset, and everything like that. When COVID hit, all the traditional ways we're doing functional medicine wasn't really solving the problem of big media, right? All the Instagram posts, the sharings and stuff like that. And then, so many events happened that we really had to pivot what we were doing. And from a financial standpoint, we had to switch to telemedicine quick. Now, because of Hurricane Harvey in 2017, we already switched to telemedicine. There was a small percentage of the population. But when COVID hit, everyone was forced into telemedicine because they can't leave. So the technology adoption rate, even in the elderly population, went sky high. And all of a sudden, people were wanting to do telemedicine. So we switched to telemedicine. We kept most of our employees home. Actually, most of our employees are still home doing telemedicine. The health coaches, we're doing group sessions in person. Now that's changed into online as well. And so that all happened within a span of, I actually want to say 3 or 4 days of initiating that quarantine. And then the whole thing with HIPAA regulations, softened up, and then Zoom got hacked, so we have to stop doing that one. So there's a lot of technology that was being adapted, and it really slowed things down and really, really hurt us because in most medical practices, our fixed costs are astronomically high, right? And so we really had to pivot, and instead of defining us in the business that we were in, we defined us as the business that we had to be, and that's dealing with the COVID and giving people back that certainty. And so from there, we were able to develop an entire campaign and summit with COVID, which you're a part of, James. So thank you for that. and got a lot of influencers on a summit to really just keep people, at ease. And so I think from there, there's been so many different permutations, and I feel like every day is different here. But we're kind of in that stage of transition from, okay, here's what we did for functional medicine before. We pivoted into a lot of the COVID stuff that we're doing. And now, over the last few weeks, I've been asked by a large hospital system here to actually help them in reducing their ER load. So we opened our IV infusion unit. We opened our facility here. So they were sending people here to the clinic because they don't want them hospitalized so they're not sick enough. So we ended up dealing with a lot of critical illness here in the facility. Not what I expected to do in functional medicine back in 2017, but that has provided us with a lot of insights. But we were able to practice acute care functional medicine. And I'll go into that a little bit later on what it means. But that's sort of the pivot that we had to do.
Yeah, that's super interesting. Yeah, I think just we'll get into some of the clinical protocols and some of that shortly. Right. Early on in the series, obviously, Houston has had an interesting story in that everyone was panicked at the beginning. I think they even came into Houston and set up a field hospital, right. And then it was closed because no one came. And then suddenly, there was a much later sort of hit of COVID in Houston than, let's say, in the Northeast. And so, riding those. But I guess what I really want to get into is early on, you and I were texting back and forth about this emerging model in Italy, right. That doctors were there where they were calling it decentralized community care. And I would love for you to share about how you adapted that model, because I think inside this question, and this is why at some point I did say on social media that I thought Dr. Orn should be the new Surgeon General, but because ultimately what I felt that you had cracked with the model was a way of delivering high standard hospital quality care to people in their own homes, and being able to have the theme of functional medicine, care delivery, but happening in a structure that was actually very well set up for a pandemic. Because one of the things that we've learned from this pandemic is that having a centralized healthcare system where everyone shows up in the same hospital is not not particularly ideal when you have a virulent pathogen that transfers very easily. So take us through a little bit about what that model looks like, and how people engage with it, and sort of what decentralized community care looks like for you.
Okay, yeah, I think the first thing to really define is what decentralized means, right? And I wasn't really sure to begin with. I got some clarity. So to me, decentralized is basically taking the power from someone who's very much higher up, maybe not in clinical practice, politicians and stuff like that, and having decision-making be the people at the front line, seeing exactly what's really happening out there. And that's the generality of what decentralized means, and it happens in things outside of healthcare as well. And so, part of the decentralization process, it really requires an entire team of people sharing the passion to get the actual data, right? And what that means is that whoever holds the data holds the power. And so we are wanting, as the functional medicine community, we were wanting to be the dominant force out there, be the voice of all medicine in general. Then we have to have the data to really support it. Now, what's great about COVID is that everyone's already hyper acutely focused on the data, looking at the number of incidences, positive tests, negative tests, looking at how full the hospital systems is. And so using that data, we can have a conversation. And I think, it takes looking at numbers and translating into words for this to make sense. So what does that mean? So it means that, okay, well, we really have to keep an eye on how many people are affected, how many people test positive, how long are the lines at the testing centers, right? And the number of messages coming in, and I probably got over 200 messages on hydroxychloroquine alone, right? And the people having a lot of that fear and what it's doing to the healthcare system. And so what I do, because there's multiple providers here, I spend most of my time talking to other providers and politicians and city council members and stuff like that. So I go to them. I'll say, listen, the hospitals are getting full, and this is back in March, right? The hospital is getting full. It's not necessarily with COVID. A lot of people with a lot of fear. How can we alleviate that system? What is the metric that you guys want to have? How many people do you want to alleviate the ER of so that we can do it? So we engineered programs based on the numbers they're trying to reach. And, you know, we have a large hospital system here at Memorial Hermann, like, well, we like to decrease this hospital by 7%, this hospital by 11%, so we can have the staffing there and everything like that. I was like, great, awesome. Well, how many patients does that really translate to? And what are these patients' main pain points and needs? What are the top 5 diagnoses that are being seen in a hospital that you're rejecting or that you're transferring to somewhere else? And how can we develop that into an outpatient program, right? And so I got the information. A lot of people are very fearful. They have fevers. It may not even be COVID. It could be the flu. They come to the ER just because one of their family members had COVID. So we're like, okay, well, let's do this. Why don't we just have a conversation of the pain points of the people and allow them to have the process of an outpatient delivery model so we can get all this done. So I think, James, shortly before the summit that I invited you to, we just finished our COVID drive-through clinic where we were screening people. And at that time, we thought that the biggest complication of COVID was pneumonia. Now it's a whole lot different. And so we did a screening for lung ultrasound. So we did lung ultrasounds. We looked at autonomic balance function. It's all through a drive-through clinic. And we were able to risk stratify the people. It's like, hey, on the ultrasound, you're not developing pneumonia. On the ultrasound, on the O2 sat, you're not getting your oxygen low. And those people who are higher risk, we gave them remote monitors. So remote monitoring is basically devices that measure oxygen saturation or other vitals that is reimbursable by insurances. And so we have our health coaches now became like the call center of this remote monitoring, right? And so that we're able to identify people who at the time of our screening was fine, but literally a day or two later, the oxygen levels went down, and we're able to give them care and execute that level of care to the appropriate places and to the appropriate hospital without necessarily going to like wait 5 hours in the ER and going to this place. We're like, you know what, this hospital, I know it's 40 miles away, but guess what? They have a unit for you right there. Let's go get it checked out. We're able to save some lives, and I'm really proud of that. That's what decentralized medicine should be, is people like us who seek out what is the end result that public health, people in public health is trying to achieve, and how can we be the solution for it? And that requires a much higher level of conversation.
Yeah, absolutely. So yeah, one thing I just want to hammer home from what you just said, which I think is critical, is, you know, we have to be nimble, right? And we need to pivot to the needs of the community. And no time in history really has there been such a, you know, dramatic shift in our history anyway, where the needs were that different. And I think that for many doctors who were practicing functional medicine, you know, they had one thing that they did, which is people came in and had appointments and they did the lab test and they had a structure. And what I hear from you is just, you know, how quickly you're able to really think like, what does the community need now and how can I provide it? And I think that's going to be really critical in the future. So obviously developing that digital pathway is important. When you we did a webinar together for PLMI back in April, and you shared kind of some of your thesis that had come from doing the group visits around a sort of a unidirectional versus a bidirectional interface in medicine. And I'd love for you to unpack that, because I know some of the, you know, I understand decentralization, which is not having everyone come into the same place, but it's also community-based decentralization, which means, in my idea, that there's going to be peer-to-peer delivery of value. And I'd love for you to just get into like how you thought about that and how you facilitated that.
Well, I think since the beginning of opening the practice, you know, I always thought that there was a miscommunication, and I call it risk, the four risks in medicine, between the patient and the doctor, between the doctor and the insurance companies, between the patient and the insurance companies, and between doctors and other doctors. And that risk is caused by a lot of different, you know, scenarios, but part of the whole decentralization process is basically bridging those gaps, right? And, you know, back in April, we were talking about unidirectional versus bidirectional. A lot of people are used to, them going to the doctor, being told what to do. Here's a prescription, right? And so what happens is, if that prescription did not provide enough value to the patient, there's resentment that's there. So there's a rift between the patient and the doctor. And a lot of times it's actually conversation. Or if the patient goes to the doctor submits to the insurance company, there's a denial of claim, and then the balance goes to the patient. Now there's a three-way rift, right? And so what happened is, these are all unidirectional conversations, right? The doctor telling the patient what to do, and the insurance telling the doctors, no, we're not going to reimburse you for that. And then the patient's getting the bill. It's all unidirectional conversations. A bidirectional interface, a bidirectional conversation is trying to figure at every level, what is the end result we're trying to achieve. And so when a patient comes in here, and we have a very, very solid structure, they come in here, there's different processes they go to. And one of the first one is, hey, what is the end result you're trying to achieve? And where do you see us fitting a role into what you're trying to achieve? And when you start out with like that, and you address each of the pain points the patients have, that becomes a bi-directional conversation, because you're not assuming what the patient wants, right? But you're delivering on what the patient wants at the time while giving them the need. Now, how does that relate to insurance companies? Well, you're assuming that insurance companies don't want to pay me for the time for the patient. Here's the code. But proactively, I can say, hey, insurance company, I am trying to get your patient's blood sugars down to this range and take them off these medicines. Are you okay with me submitting these codes, right? And so that's what we've been doing for a while, and that's that bi-directional conversation between each of the RIFs and medicines. And there's an order of operation to do it that we've been doing, and I think, finally 3 years in, we kind of mastered that technique since COVID hit, which really accelerated that conversation.
Yeah, no, I think that's really important. And I think, more and more of the clinics that I've seen in functional medicine that are doing, getting consistent results are having those kind of conversations with patients at the beginning to really engage them into the process. I was at a clinic actually just a couple of weeks ago up in Idaho, where they have a health coach and a care navigator who are right at the front of the care to really get clear as to, like, first of all, meet expectations with this practice. Second, get really clear as to what the goals are. And these are both actually like free services, because they know that if they do those things right and get the right people coming through the system, that the lifetime value of the patient for the right people is going to be totally fine. And they've worked those numbers out. And I think that a lot of clinics could do a lot better to identify these kind of things early on in the process. I've heard of, actually next week on the podcast, we'll be featuring a topic about orientations and setting the right starting point for patients to understand what's theirs to do, what's doctors to do. And this has been sort of like the lifelong battle in functional medicine, is that there's a different sort of balance of power, and there's more expected of the patients in their participation. I know you were doing a lot of group visits before. Can you share about some of the virtual group visits and that you've been running, and how that has interacted with the remote patient monitoring, and sort of how you see those two things coming together for the future of care?
Yeah, so right now, most of the virtual group visits are actually my health coaches are conducting, with group Tai Chi and all sorts of different really cool things. And since COVID, most of my attention is, and the reason I'm wearing scrubs is I'm actually seeing COVID patients. So I kind of handle that aspect, the critical care aspect, while the rest of my team handles some of the other stuff and doing telemedicine. Here's the thing. I think a group visit is the perfect place to set an intention, right? Having that first meaningful conversation with a human. And so, because from a group side, it's really easy to communicate, but a group visit can also be bidirectional. It should not just be one person lecturing to a group of people. And it's really easy to say, hey, what is the end result that you're trying to achieve? And then when you kind of go around the room, you realize that people are kind of trying to achieve the same things here. And the energy of the room, I'm talking about a virtual room, like on Zoom. The energy of the virtual room becomes a lot more relaxed. And like I said, functional medicine is a delivery of certainty, delivery of a feeling of safety to the patient. So that whenever you're in a group visit, that is accelerated 15-fold, right? That level of safety. And then you combine that with the one-on-one visits, and then you have your health coaches come in with functional medicine health coaches they come in on the back and say, hey, this is the stuff that we want to promote and talk about. We want to solidify it from the group visits, and we want to look forward to the next one. So I think a sequence can be delivered, but you're right, James. The most successful functional medicine practices that I've spoken to a lot, are the people who at the very front end is like, hey, here's some expectations, but also what is it that you're trying to accomplish, and where do you see me or us fitting into your journey that you're trying to accomplish, letting the patients know that they're the captain of the ship, right? Letting them know that they actually have the power to heal, but you're a guide. You're not going to be, using a lightsaber to slay their dragon. You're going to be giving them the lightsaber to do so, right? And so I think that's really easy to do in the group visits. It's really easy to do up front with, what would you call it, a care coordinator? Is that what you said, James? A care coordinator?
Yeah, experience coordinator, yeah.
Experience coordinator, yeah. So I think that's a fabulous thing. And the way we do it here is, so when a patient comes in, generally they see, it's not like, yes, we have 7 providers and they do 7 different things. Is they see one first, and they come to me, and I'm like the coach, and I'm really the care coordinator. Say, hey, these are our experts. This is what we're trying to do. Here's what we accomplish. Here's a short-term plan, a midterm plan, and a long-term plan. Are you okay with that? If not, that's cool. If you are, then that's great. This is what I'd like for you to do, and then come along with the process. And when people buy into the process, there's a lot less questions on the back end, and that gives them the highest level of safety. It gives them the highest level of certainty that they so desire in functional medicine.
Yeah, I mean, I think community sends a signal of safety so powerfully, and I think that's a huge piece. I want to get into your clinical protocols here in a minute, but just to a little deeper on the health coaches, can you just share with us, like, how many do you have? What training do they have? How do you work to coordinate them and bring them into your healthcare team? Because I know that a lot of doctors and practitioners out there are really not struggling, but are just looking to optimize the way that the coach and doctor relationship really works. And I'd love to just get your thoughts on that side before we move on to the clinical piece.
James, I could talk about for like 5 hours, but I'll give you some main points here. So we have 2 health coaches, and they're functional medicine certified health coaches. One of them is also a mind-body medicine practitioner, which I believe that should exist in every practice. And the other one's actually an expert in genetics and stuff like that. But here's the thing about health coaches. Like, I hate to label them just coaches, because they have different personalities, they have different things that they're passionate about. And whoever comes on that we hire here, we have them do a personality test, and we actually know what their disc profile and other different personalities are prior to coming on board. And then what we do is, how can we cultivate somebody with this personality and matching up with the patient with this personality so that they match. So there's 2 major separate personalities between people, but let's say between the provider, who's either a coach or a doctor, to the patient. There's the type of people that the patients that will come in, they'll sit down with a noteboard and they'll write down everything that you say, right? So that's one personality. And if you match them with a coach with a very opposite personality, who likes to look at the big picture, who likes a lot of the experiential, but who may not be as granular as detailed into the little note taking, that's a mismatch. And that's a natural tendency that we do. We're born with these personalities and can adapt to them, right? And so when it comes to health coaches, the health coach's job is to have the most meaningful conversation they can possibly have with a patient that the doctor does not have the time to. So the health coaches aren't the support structure of the practice. The providers are the support structures of the health coaches. Okay, we really have to reverse that mentality around, because we tried the other way around. It doesn't really work. And so when you know that the health coaches are your true front line in getting into those meaningful conversations, that they represent you and vice versa, then you're able to use your health coaches as leaders of the practice, having those meaningful conversations, and create a massive, dramatically improved outcome for it. And it's and when we change that, and we are all our metrics we're tracking for clinicals, for blood sugar and weight, and MSQs, and we do quantitative EEGs, sleep improvements, stress improvements, all that accelerated by twofold once we're able to change that process.
Absolutely. Yeah, that reminds me, there was a quote by Woody Merrill, who I saw speak at PLMI a few years ago. And he was asked about his program at the Continuum Center, which was actually shut down as part of Mount Sinai. And he was asked, look, if you could do everything again, like, what would you do? And he said, you know, when we had it, we had doctors in the middle and health coaches on the periphery. And he said, if he could do it again, he'd put the coaches in the middle and the doctors on the periphery. And it just reminds me of what you're saying, because here's a fact that I've been, you know, that I know from 15 years in the industry that every doctor has told me, but we don't seem to reorganize care around. And it's this: if the patient participates in their care and they start to really jump in and do it, they always get better. And if they don't, you know, it's just you're fighting a losing battle. And in that way, 90% of the battle is getting them activated and 10% is getting the right protocol. And yet we focus on 90% protocol, 10% getting better. And what I love about, you know, what you're doing is reorganizing around that universal truth. And I think it really, I think for everyone listening, if you could really think about, you know, if you were to prioritize in your clinic getting people activated, what structures would you put in place versus getting better and better and better at coming up with the exact protocol? Because what I hear from patients in functional medicine many times is that it's way too complicated. I couldn't execute it. I feel like, you know, being healthy is a full-time job. And ultimately, if we really want everyone to have a great experience with functional medicine, we need to think about that. So, you know, one question that's just come in actually that I wanted to jump into because it's right on time. You mentioned remote patient monitoring. You mentioned group visits. Can you just tie those two things together? Like, what tech are you using? What's the frequency? You know, how do you bring those two together? And then we'll get in a little bit more into the clinical side.
Yeah, I guess I'll start with the tech part. So we have our electronic medical record system. We use eClinicalWorks. I think that's the second most popular in the US right now. And so there's a lot of devices that sync with eClinicalWorks, and you can get data from there. You can get data from people's Apple Watches, and get data from other devices that sync with, like, the Apple Health app. Android's coming out with a whole new thing, or with the Withings, which I think Withings is actually Nokia, I believe. And so all these companies are currently working together in the remote patient monitoring space. So we've had several permutations. You know, last year in 2019, when we did remote patient monitoring, way different than what we're doing right now. And that we're actually in the middle of switching tech again, because there's so much competition in space right now that the big people are starting to take over, which is Apple, Google, and Withings. They're starting to take over because they can have access to data and they can synchronize with the major electronic medical record systems, right? And so how that ties in with the group visits is that whenever we have data, the data has to have a data champion. Someone has to look at the data, especially if you want to bill insurance and stuff like that, right? And so the people looking at the data have to have an order of operation of how and when and what to do with the data. When do you escalate to a nurse versus a physician versus keeping on the health coach level and have that meaningful conversation with the patients again, right? And so the more important question is, what is that process rather than what tech we're using? Because the process we develop has to be tech agnostic, right? That way we can pivot if a company, you know, goes downhill and stuff like that, which we've experienced before, by the way. And if the vendors go downhill, you have to pivot, and that pivoting means that you have to lay the groundwork there. But where the group visits come in is that you can actually go over a lot of the data during the group visits while the health coach is talking before the physician comes in and does his or her thing, and go over a few things and grab them at the end of the group visit to a one-on-one. Like, hey, I saw your blood pressure was 210 over 180. What's up with that? You know, a little concern, and then create a whole path for this patient. Where does this patient now go, right? And so I think from the operation side, getting data is good, but knowing what to do with it first prior to you getting it is far more important question. But you can do it through the setting, absolutely. Yeah.
Setting up the right structures and algorithms by which to know, you know, where it's going to go in what order. Okay. Well, look, I know that there's some questions coming in. Maybe if you have questions just about how Dr. Rawn is operating that, feel free to put questions in. I do want to talk about the clinical side, because one of the things that we've spoken about before is just you mentioned certainty earlier, and I guess I would love you as an allopathic physician practicing mainly functional and lifestyle medicine. What gives you certainty? What are things that you can build upon, and how much certainty has your average physician had during COVID?
Well, I'll start with your second question, which is how much certainty does the average physician have with COVID? They have very little certainty because healthcare is not decentralized. They don't have the power to conduct all these different things, right? They don't know the reimbursement process. Every week, CMS comes out with new rules. We're going to allow this, but not that. And then you're going to bill with this modifier, but not that modifier. And then a week later, it's like, oh, I'm sorry, we're going to go back to the original modifier. And the week after that, no, actually, we're going to go to modifier 11 instead of location number 2. And so there's so many minute changes in the operation of medicine from the government, from CMS, Center for Medicare and Medicaid Services, from ACO, which is the Accountable Care Organizations, where we're a part of. And all these conversations, if you don't check your email for 2 days, you get lost in the process. That creates an absurd amount of uncertainty, right? And then for those people who are doing functional medicine with cash, I know a lot of my friends, they did the temporary furlough, just want to step back for a little bit and see what's going on. They have their own level of uncertainty. I have 4 practices that were doing integrative health and insurance. After COVID hit, they went to full cash, and they limited the number of patients coming in and gave us all their patients on the insurance side, right? And so they have very little amount of certainty as well. Here's what gives me certainty. And by the way, I don't have full certainty either. I don't know what's going to happen, right? But what gives me certainty is the team, right? And so I think that as physicians and as a business owner, your main priority is the people around you, your medical staff, your front desk, your biller, your janitor. That's your priority first, before patients. Why? Because that is your crux of how you operate on a daily basis when you come into the office or when you're trying to arrange a team, right? Your team around you takes priority. Their health and mental health takes priority. Once you're able to care for your team, the meaningful conversation comes in, and now you just have replicated the end result that you're trying to achieve and your attention to them, and they can go out and be your armies and talk to the patients and give them that level of certainty that, hey, Dr. Rawn is doing X, Y, and Z. We want you to do, this and that, right? And so I think that for too long, and this is, I really blame this on the medical training system, going through medical school and residency. They're like, no, your priority is not yourself, is not your family, is not your staff, is not your colleagues, it's the patient, okay? But that model has created a very decrepit system, or it strips the power away from the physician. And that's why the leaders in healthcare aren't the ones that should be talking at this particular point. And we have a small family of functional medicine-driven providers that is trying to change the system, but we really have to do it together for that level of certainty. I hope that makes some sense.
Yeah, it makes sense. I mean, I guess just clinically, you did that whole summit at the beginning of COVID, and you had all kinds of experts talking about, okay, what's good for immune resilience, right? Can you just, I guess, compare and contrast what you learned in that versus, sort of the ever-changing recommendations of drugs and masks and whatever else that's coming out?
Really good question, James. And that kind of ties in from my last thing about certainty, right? And so the best part about functional medicine that I think everybody can appreciate is when you look at the bodily function, it doesn't change, right? It's, your Krebs cycle is always going to spin, right? And the way that the mechanism is, your thoughts, your emotions, mental health, the entire operating system is still there. So in functional medicine and doing those summits, when Dr. Bland came in, Dr. Hyman, and We had Christy, who's an expert in pregnant women and in immune resilience. We really have to rely on other professionals and each other and just listen to each other, look at the data. When Dr. O'Brien talked to me about the Spanish flu data and those people who die from it have significant vitamin D depletion, I didn't know that. But those are the things that we collect data for, that people are seeing, that we have to have that meaningful conversation so that we know what is the foundation of what's going to help your immunity. Because if you look at the conventional side, all right, one day it's hydroxychloroquine, another day it's not, and the third day it's a tweet that may be showing that hydroxychloroquine can work, and there's 14,000 other different Instagram posts and Twitter and stuff like that. So social media has driven that level of uncertainty to the highest it's ever been, right? But what social media is not talking about is the fundamental, human physiology, right? And there are stuff like, vitamin D, vitamin K1 and K2. There is polyphenols and different nutrients that can support our immune system. Those conversations haven't changed. So when I look back at the summit that we did in March, and I re-looked at, by the way, there's 29 hours of video. So I re-looked at some of the videos thinking that, hey, are there recommendations that I want to change in this online course? I'm like, I don't want to change the dang thing, because all we did is talk about underlying functional medicine principles and human physiology that this video is going to apply for. It doesn't matter if it's March or June or August or late December. It's still going to be consistent. And that tells me that functional medicine is able to provide a superior level of certainty for the public, for the people, far more than anything that's kind of chitter chatter that's out there.
Yeah, I think that's such a critical point, and I just want to reinforce that to everyone who's listening here, is that the recommendations inside functional medicine have been consistent all the way along. The recommendations in conventional medicine have been all over the board. And that really speaks to an operating system of medicine that is built on how the body works, because immune resilience for this pandemic will be the same as immune resilience for the next pandemic. And that's what we really have to focus on with our patients. So I think that's so well said. I want to talk a little bit about how that has sort of gone out in your community shortly. Maybe let's just take 5 minutes and just share, what is your protocol? Let's get into some specifics, here, as far as what are the top products that you're using? What are you recommending to people who are suspected of COVID? Practically, what does that look like? What are you putting people on specifically?
Sure. So I have the really good privilege of speaking to the Chinese who had the initial data in Wuhan, right? And I have a really good privilege of speaking to an American company who's a Chinese contract in Wuhan, and they were a lot of their staff were amongst the first to get COVID. And I have the unique opportunity to talk to data about infectious disease docs. And in fact, on my summit, we had a bunch of physicians that weren't even in functional medicine. They were infectious disease experts, but they were kind of saying the same things. And so I think the conversation kind of led to an exploration of, yes, there's unknowns, but we kind of have to know what to do with the unknowns. And the thing that we really have to fall back on is functional medicine principles. But I think talking to the community is the most important thing in the world. Unfortunately, the old way of talking to the community has been on digital social media, but right now, everyone who does any post is under so much scrutiny. There's so much censorship going on, and what happens is that people get lost. So whenever I recommend a supplement regimen, for example, right? Well, people are like, well, what about this? And what about, this video saying that vitamin D is useless? And there's a lot of attack coming on. So there's a lot of fear that's there. And so, so I always fall back on, okay, well, let's look at the 3 things you need to live. Forget about COVID, the 3 things you need to live: food, water, and air, right? So eat a clean diet, drink plenty of water, and breathe, okay? And so most people don't understand that when they're looking at social media at nighttime and they're watching the Instagram, they ain't breathing. They're not taking deep breaths. So, all the light that's coming in is inhibiting the circadian rhythm, the sleep-wake cycle, right? And that causes a downregulation of immune cells that's supposed to protect you. So physically, the act of looking at these digital media and these thoughts coming in from media is depleting people's immune systems, right? But the battle still rages on. So once you're able to optimize the food, the water, and breathe, and then we talk about sort of supplements after that, right? So we look at Spanish flu data, we look at SARS-1, for example. We know the association of vitamin D deficiencies and the severity of illness and mortality. That's very, very well documented. That's very well proven. We looked at vitamin K2, right? And then we also look at the people who tend to eat more variety of species of plants tend to do better, right? Getting all the different polyphenols in. And then, so if they're not eating all these plants, don't have availability of all these plants, but what are some supplements that we can do with phytonutrients, powder, shakes, stuff like that we can do? And obviously a lot of this is individualized. So my staff usually gives them a recommendation that's individualized. We kind of go on the FullScript platform, give them a recommendation on there. You're going to do this for this long, like a prescription, and then they start doing it, right? And then what we do is we have very close follow-ups. If they do get diagnosed with COVID, I follow up with them every single day. Say, hey, how you doing? Check in with me today, right? And if they do well, then that's it. We keep on going. If they don't do well, then we go to some of the conventional stuff. Maybe I can give you some hydroxychloroquine. Maybe I can give you something else. Maybe something else is going on. And I'll tell you that I've only had to do that once throughout this entire pandemic. And when I prescribed that patient hydroxychloroquine, she didn't even take it because on day 2 she felt a lot better, right? And so I think that's really important. I think vitamin C and zinc is very important. That has been shown to upregulate T cell activity, natural killer cell activity on different viruses. I think that getting sunshine on your skin for 20 minutes a day, it's you can tolerate it. Some people can't. It's very important, and having open air circulation. So these are some of the things that we have. And what's cool about technology is that we can give these directions through our electronic medical record system. You can actually go into FullScript and give them directions. There's templates you can do in FullScript, give them directions that gives you recommendations. So there's a lot of ways to have that meaningful conversation with patients. But yeah, fundamentals: air, water, and food, and then supplements, and then doing the habits, exercise, getting the sunshine, and everything like that.
Yeah, one of the things that I've heard throughout the pandemic is that conventional doctors are sort of like a little bit, in some cases, I guess, waking up to the fact that there are ways to build your immune resilience through supplementation. I've heard that from all kinds of different areas of the industry. So has there been anything locally as far as like other docs in Houston wanting to suddenly pick your brain that didn't really care about supplements before?
If I can show you my text messages of how many docs text me for recommendations, you'd be shocked. Yesterday I was talking to a pediatric gastroenterologist, right, for a patient with like Crohn's disease, right? What should I do for this patient? We were talking to 2 cardiologists that was trying to figure out what to do because, the topic of this person's having depression and hurting a lot on statins. What can we do? So I think because the physicians are doing telemedicine right now, their presence is actually physically in someone's home doing telemedicine. And so what's happening is that they see the patient in their environment, and subconsciously they're thinking about what their environment's really going to be. So our health coaches, they get patients to take their phone, like, while you're here, walk over to your pantry. Let's take a look at what's going on over there, right? For a lot of the conventional doctors, once they see that they're in the home environment, the conversation comes out because you can have family in the background asking a billion different questions, right? And so most of the time I'm getting these text messages from this conventional doc is because it doesn't matter if you're a functional medicine doc or if you're not functionally trained or anything like that. It doesn't matter what it is. We are all trying to provide a level of service and a level of care for our patients. And right now, we're going to do whatever it can, whatever it takes to take care of our patients. And the conversation has opened up a lot. Like I said, vitamin D, CoQ10, bergamot, right? All these different things that have kind of opened up. And people are now becoming kind of self-experts of the immune system because people are staying at home Googling and then talking to the cardiologist. And the cardiologist is like, well, I don't know what bergamot is, so let me text Dr. Ron and see what it is. So I think the conversation is starting to be a lot more robust.
It does seem that there's, like, on one hand, you know, recommendations that are good for everyone for immune resilience, but even this idea of, like, you know, you may have a level of dysfunction in one organ and system that's causing your immune system to go down. So you've seen the stuff with glutathione, right? If your immune resilience is low because of liver function, or N-acetylcysteine suddenly got hot 2 weeks ago, you know, maybe there's some there. Or even I saw, you know, Stanford MedPage today, they obviously weren't watching that thing we did with Dr. Vojdani because they were shocked to find out that people with leaky gut, or what looked like, as they were describing leaky gut, were having worse COVID responses. So it seems, you know, maybe even in the sort of individual, what would you say, like organs and systems, there's a starting to be a realization from doctors that, you know, breakdown of certain key organs and systems in the body leads to a lack of immune resilience that leads to severe COVID cases, and that ultimately building up levels of function in certain systems is a priority. How do we sort of keep functional medicine momentum into the mind of the conversation with conventional docs, you know, moving forward?
I think that this question, if you asked me 3 months ago, might have been different. Right now, I think it's important to have conversations with other doctors about basically just how they're doing. James, we start by maintaining our own level of sanity, our own level of peace and certainty, right? And so a lot of docs have come together to make Facebook groups. I'm in a Facebook group with 12,000 other private physician docs right here. And everyone's experiencing uncertainty in their own families and themselves and their incomes because of what's going on here, right? And so I think when we are going into that group, we realize this goes well beyond functional medicine. This is the medical profession in general. The medical profession, we don't have a lot of control over our lives sometimes, right? And going in there and then looking at stuff like HIPAA, all right, and seeing how HIPAA was designed, and you kind of think about, well, there's some hurt that's there that is on the practitioner side, and looking at different policies and the fact that physicians cannot unionize in the United States, looking at physicians cannot be within the labor laws, right, of the United States. Like, what's going on with that? So I think the conversation starts by looking internally, understanding that there's pain points in practicing medicine in general, talking to the other people, and letting people know that, hey, you know what? I do medicine. I also do functional medicine, and this is the meaningful conversations I've had with my patients. What about you, right? And I think it really just starts there, and just being very open to everyone. And I feel like there's too much conflict between integrative health practitioners and conventional practitioners. I think it's been a difficult relationship just because of a lot of the resentment that's come up. But I think COVID has really gathered the people together and say, hey, we really need to work on this together. Everyone's on the same team. Let's get it done. And that's how we eventually can decentralize a lot of these processes in medical care.
Well, I appreciate you saying that. And I guess I just want to give a specific shout out now, because at the Evolution of Medicine, you know, obviously for the last 4 years, we've been running meetup groups of doctors, you know, and we're in a sort of a pause right now before we roll out our next phase. And that next phase is a desire to really make it easier for doctors to get together. And I want to give a shout out. If you haven't listened to this week's podcast with Dr. Olivia Joseph, she talked about how in St. Louis, with their functional medicine practitioner community, they were able to, by discussing together, you know, identify specialists in their community that were maybe not functionally trained, but definitely open to these kind of ideas. And in that way, actually build a network of specialists locally that they knew that they could sort of refer to, that would reinforce the way that they were doing medicine. And I think this is really the next step in our growth, which is, yes, we have this core of functional medicine doctors and practitioners in each city. How can we start to kind of infect the rest of the medical population? I think like just picking off people, getting them together, keeping the communication platforms open is something that we're going to continue to move things along. So I do want to make sure that if you have questions for Dr. Ron, please put them in the chat. We do have a few questions coming in here now, and I'm going to ask. There's a few like very specific questions here, which ultrasound do you use, Doc?
Like the model, I'm
The
assuming.
model.
We have four.
For
We
COVID, for COVID
tell you the
screening.
brand. That's, yeah. But we have a Sonocyte Titan that I lug around to do a lot of local stuff. Our sonographer uses two giant massive machines that we got from the hospital that's able to do a bunch of different types of ultrasound, and that's the one that we use for the lung ultrasound. But as far as model, I can't tell you. I don't know.
Okay. Tell me a little bit. So we've had a question here. Does Dr. Rawn have a good resource? I mean, you may know the answer to this. I think you do. For those of us who are cash-based but need someone to consult, re how to code for visits so that the itemized receipts with codes help patients get maximum reimbursements. Should we say watch this space?
I think there's a lot of resources out there, and James, you may know more of the resources than I do. But I have a CFO here, which is really nice because he knows way more things than I do. And like I said, you gotta have focus in on your team and who's doing what. But we kind of have all our resources are in-sourced, so I don't necessarily have consultants or anything like that.
Awesome. All right. So yeah, any more? Please put your questions into the group. I mean, ultimately, I guess I'd love to just get your thoughts. I guess more generally, you know, everyone's got an opinion on what's been happening in COVID, and maybe if you just take a step back as someone who's been on the front lines, has contacts in China, who's doing things here, who's seen the ups and downs, who's been on the front lines of treating, like, what do you think? Like, where are we right now? Where do you see this going? And you know, and sort of what's your, if you get involved in a dinner party discussion about COVID, what are the points that you're making that people who just watch TV would never understand?
Yes, I'm so glad you asked that, and because I get a bunch of messages on emails and secure messages and Instagram and Twitter and Facebook, basically sending me videos, right? Masks, no masks, quasi-mask, or all these different things, and I feel like it's distracting. I feel like people are asking the wrong questions, because I feel like you know, masks. By the way, I wear masks. I have one right here. People are asking, you know, Dr. Rawn, what do you think about masks or cloth masks, surgical masks? Do you think it's useful? Should we just not wear masks? But those are the wrong questions to really ask, because what they're the real question that they're trying to ask is, can you give me a level of certainty and safety so I know which side to listen to, right? That's a big problem. That's a big problem because it divides the country, it divides the world, right? The real question is that you want to be able to develop a level of safety for your body so that when you get COVID, you know exactly what to do. You know the order of operations, right? Hey, I want to get my nutrients high. I want to eat clean. I want to make sure I get sunshine. When I get sick, when I cough, I don't want to be around people, right? And I want to have a mindfulness and meditation, because through meditation, I can upregulate my immune response faster than any supplement or diet you can do, right? I want to make sure I sleep. I want to make sure I turn off my social media at 7 p.m. and don't have any unnatural light coming in, like from the phone at 7 p.m. If I can't help it, I'm going to turn on some night mode. Those are the conversations we really should be having, instead of like mask or no mask, because ultimately it doesn't matter. If you are trying, and this is for everyone out there, it doesn't matter if you're a doctor or not doctor, if you're trying to establish a level of safety and go away from fear, stop listening to the digital media. Listen to what the functional medicine docs are saying, because I know what they're saying. We're all saying the same things. What I just said is a fundamental principle of getting your immune resilience, and also the immune resilience of your family. So instead of saying, oh, what can I do to prevent me from getting COVID? Do I do mask, no mask? I was like, act as if you're going to get COVID anyway, and research what is it that's going to get you out of it, so that when the worst case scenario happens to you, which is COVID, you already have a plan. You want to plan for pitfalls, and that's the truth in everything that you're trying to do. So people need to plan for pitfalls. When I get COVID, what do I do? Or what can I do before I get COVID to decrease the amount of symptoms I'm going to get, right? And those are the true conversations to have. So that's what I talk about at all my, well, I don't have dinner parties anymore because I'm in quarantine, but all my Zoom discussions and stuff like that.
Yeah, I think that's such a huge point. And I think that this conversation about immune resilience is something that really, is ours to own. I think that, there's so much good information. The IFM information that was put out, I think was really good, well thought through, well organized. This is our moment to shine, I think we're all a little bit horrified that there hasn't been like a nationwide get healthy campaign, which by the way, there is in the UK. And why? Because Boris Johnson got a really bad case of COVID and he was significantly overweight. And so actually there's a lot of movement happening in the UK where now they're actually allowing doctors to hire health coaches into their primary care practices to deal with exactly this issue. Now, we haven't had that kind of coordinated response here in the US, and I think we're all a bit like confused as to why that hasn't happened. But ultimately, it does create an opportunity for you, the local practitioner, to become a voice of reason in your community and to be the voice of reason that's saying, hey, we can all work together to build our immune resilience. And I know that there are issues of people not being able to have those kind of conversations for different reasons, but I do think that this is an opportunity for all of us individually and collectively to start to put out great information to our community about what they can do to improve their immune resilience, and that ultimately this is a moment where people's faith in conventional medicine is falling through the floor. People's realization is that they have very limited tools to be able to help with this pandemic or any future pandemic, and that ultimately there is a certain level of safety that comes from one community and a certain level of safety that comes from the immune resilience principles and an operating system of medicine that that is consistent. And I think that you shared so much about that here, Cheng, that I really I think it has a ton of value. So there's been a couple more questions I want to do just before we finish. Annette was asking about a summit. Dr. Ron did a big summit back in like March, right, where you just interviewed people about COVID-19 every day for a few weeks, that I was excited to be part of. That is something. Can people still watch that or not?
Yeah, if you just go to the website, it's a TCLM University, so it stands for Texas Center for Lifelong Medicine. So www.tclmuniversity.com, and it's the first link that's on there. You'll see Coronavirus Summit on there.
Hey, there's a question here, which is, do health insurance companies pay for functional medicine visits or health coaching? And I think this is like the crux of it, which is that, I had not, I've been convincing doctors to go away from insurance because it was an unsteady platform. But what I learned from you, Cheng, a year ago was that, the sort of rules were changing, and actually it was a lot more possible for doctors to bill for care. So let's just jump, while we got 5 minutes, do you want to just talk into a little bit about that?
Yeah, so I took this course called Master of Negotiation back in college before I volunteered for the NYPD and their suicide prevention program, and it's on neuro-linguistic programming, NLP, right? And so my biggest takeaway from that is that whenever you're trying to fight for something, you have to mirror and speak the other person's language. Insurance companies, the word functional medicine is not in their vocabulary. So if you are speaking functional medicine, then they don't understand. You got to speak the same language, okay? So what's in an insurance language is complexity of visits, time of visits, who's conducting the visits, who's conducting visits for how long and when, and what's the interval of visits. These are 5 questions that insurance companies want to know. These 5 questions are from 3 different categories. So the one category is who's giving the visit. Is the doctor doctor, by the way, is also not an insurance company's language. Is it a provider? Is it a non-provider healthcare professional? Or is it a non-provider, non-healthcare professional? Or is it a staff? All those 4 different layers have different CPT codes or procedure codes attached to them, right? And there's different combinations that you have. And so you have to speak their language to understand where you're getting out of it. And I can say, insurance reimburses for functional medicine, but that doesn't mean anything. But what it really means is who's delivering the functional medicine, what conversation are you having, is it a high complexity visit, how much time are you spending on, and then what does that translate into? And the most important question, James, is what are you doing outside of the one-on-one visit to prepare for that patient? That's also reimbursable. Are you using remote monitors, right, to monitor the patient's vitals? That's also reimbursable. And so you have to speak the language of the insurance companies to understand, and that language is through CPT codes, right, procedural codes. And so, yeah, can functional medicine be reimbursed? Yeah, if you fit under the CPT codes, what you're trying to do. But, functional medicine itself as a word, like insurance doesn't know what it is. So no, it's not reimbursable because they don't know what that word is.
Such a huge part. And in the conversation that we're going to be leading in the next few years, which is how does functional medicine become medicine? One of the first things that we can do is just organize ourselves around the system that already exists. And as in the last 6 months, I've had my ear really attuned to ways that functional medicine practices are billing insurance and making it work. And a lot of it goes into exactly what you said just there, which is understanding that these are complex patients and looking for ways to be, how does the medical system work with complex patients? So there'll be more information coming out of that. If you want to get in touch, feel free to get in touch with me, and we'll have more stuff as we go along. Some of the conversations that we're saying here, the same kind of questions that are coming in. Does Medicare cover functional medicine? Yes, if you organize it right. And so far, that has not, that has not been because we've been talking a different language. And ultimately, that is the journey that we're going to go on from here. So thank you very much, everyone.
Medicare is our largest payer, so absolutely. And so when we love Medicare, so that means if Medicare covers it, then it's a good thing, and it's really applicable to most people. So thank you for that, James.
And if you want, we'll do another session here in the future, maybe on this exact topic, which is like, if you want to do functional medicine on Medicare, what does that look like? And it looks a lot more like getting people to support each other and getting healthy, remote patient monitoring, health coaching, and groups, and looks a lot less that like 3-hour visits with tons of lab testing and supplements. And that's just like the overview of where things are going. Anyway, we are, there's actually, it looks like there's some interest in that for anyway. So we'll be back with more. Look out for it. Thank you so much for being here. Thank you, Fullscript, for hosting it. Thanks, Dr. Ron, for making time. Look out for more education here in the future. And I'm excited to spend this time with you wherever you are. Think about how important it is that everyone in your community knows about immune resilience, talk that language, and you can't go too far wrong. Thanks so much for tuning in, and we'll see you next time.